Hello. Thank you for joining us today. I'm Mickey from the Medical College of Georgia team competing in the value-based healthcare competition, and we'll be looking at how increased cost transparency can improve patient outcomes. I'm joined by my team from MCG today, Chuck, Varun, Harsha, and Nikhil. And so with that, let's get started. So in many industries, consumers usually get an estimate of what something's going to cost before they buy that good. So let's say you're buying a car, you usually know how much you're going to pay for that car before you get the car. But healthcare is unique in that it's one of the few industries where consumers get an estimate after the fact. They don't know what things are going to cost beforehand, and they're often left in the dark when it comes to price. And this limited accessibility can impact patient outcomes. Those with high social determinants of health, such as those with low income, no insurance, and a lot of chronic conditions, have increased financial burden. And increased medical debt, out of pocket spending, and financial toxicity can impact patient outcomes, such as quality of life, survival, symptom burden, complications, and overall medical burden. And this burden is pretty prevalent within the United States. One study found that 75% of individuals with health insurance had concerns about the financial hardships caused by their medical bills, and many patients report experiencing uncertainty about what their healthcare is going to cost. And although there are a lot of regulations, executive orders, and mandates to promote consumer price transparency and quality transparency within healthcare, one study found that only 36% of hospitals are truly fully compliant with these transparency regulations. And the reasons for this are multifold. Publishing this price data to patients requires significant investment of resources and staff and technology to get that data out to patients. And as everyone knows, insurance is very, very complex. All patients have different insurance plans, deductibles, in and out of network providers, and all these different negotiated rates, especially with the same procedure costing different things for different patients, leads to a lot of complexity in the price data that gets published to patients. And that kind of leads to a lot of the difficulty in getting data out to patients. And lastly, there's not a lot of strongly aligned incentives between insurers or hospitals to publish this data. And all this together make it difficult for hospital systems to publish their data to consumers. And this is a little snippet of the literature review we did for this project. So financial toxicity is an important factor that can impact the patient's quality of life, their overall well-being. And many patients, like we said, were unsure of what their what their care was going to cost, and they had difficulty in paying their medical bills. But what's interesting to note is that many of these tools are accurate and they're really easy to use, and they can change patient decision making. And increased price transparency can lead to significant healthcare savings. One study found that it can save up to $80 billion by 2025. But the problem is many procedures and surgeries don't publish their prices or give estimates to their patients beforehand. And what's also interesting to note is that a lot of people just don't know these tools exist. Even though they're really good, patients either don't use them or don't know they exist. And even though these tools are very accurate, easy to use, there's a lot of value to be created in getting patients to use these tools. And just a few of the shortcomings of current payment estimators, even though they're pretty good, they often give wide ranges, so that's not super helpful for patients planning their procedures in advance. And the low patient utilization rate can then kind of exacerbate some of the problems we've been talking about. And so with that, I'm going to hand it off to Nikhil to talk about our solution.
Thanks, Mickey. The key to this problem is improving accessibility and awareness of the cost calculator through a threefold solution. We firstly plan to collect data to evaluate the extent of the problem through surveying patients and providers about healthcare costs and their thoughts and attitudes about price transparency. We hope to meet with these patients and providers to have discussions and develop an understanding of their knowledge about cost estimation. Secondly, we plan to promote awareness through creation and dissemination of posters, pursuing a marketing campaign to ultimately increase the usage of WellStar's cost calculator and the patient portal through both provider and patient education. Thirdly, we plan to integrate the cost calculator into the patient portal. We plan to achieve this by integrating the tool into the patient portal app with the patient's insurance information preloaded, allowing patients to have customized, readily accessible information about their procedures and tests. Some of the measures of success include firstly, surveying at least 100 patients and 25 providers within the first 6 months to establish a baseline utility of the cost calculator. So far, in the past 1 month, we have surveyed 36 patients and 5 providers. We have also set out to develop a targeted campaign using flyers, posters, and email communications to reach at least 5 departments within WellStar MCG Hospital by the end of 2024. And thus far, we are in the process of distribution with marketing materials completed and approved. Thirdly, we plan to increase satisfaction scores regarding financial clarity by 20% within 2 years, as measured by post-care surveys. Next, we will discuss our implementation strategy. Firstly, we met with Dr. Philip Kuhl, the Chief Medical Officer of AU Health, where we discussed an optimal implementation strategy for the cost estimator tool, obtained sponsorship, and developed initial goals and a timeline for patient-provider engagement, research, as well as awareness efforts. We also met with the Vice President of Digital Platforms, where we reviewed the existing features of Epic MyChart patient portal. We explored how MyChart's features are compatible with CMS and No Surprise Billing Act regulations. And we also explored Wellstar's fee schedules, contract, and financial assistance programs, and how these can all be integrated into the cost calculator. Subsequently, we met with the AVP of Center of Patients and Families, where we developed strategies for increasing awareness of the financial cost estimator tools regarding information for patients and providers. We ultimately discussed methods to effectively reach patients, families, and healthcare staff, and we determined that the optimal awareness methods include QR codes, posters, and engaging patients during visits. And this ultimately laid the groundwork for the comprehensive communication strategies and awareness methods that we would later employ. Subsequently, we presented a literature review and perspectives poster at the Medical Association of Georgia House of Delegates poster presentation in Savannah, Georgia. Here we highlighted the role, the impact, and the necessity of healthcare cost transparency to increase awareness. Here we were able to initiate discussions and share our findings with policymakers, healthcare leaders, and MAG board members. Next, I will hand it off to Chuck, who will discuss the subsequent steps of implementation. Thank you.
One of the biggest steps for increasing awareness for the cost estimator tool is creating a targeted marketing campaign within the hospital. We met with Erin Spellman, who is the Director of Marketing for Wellstar MCG, and through our discussions with her, we collaborated with the marketing team to create flyers and posters, information cards, and mass email templates to highlight the purpose, location, and use of the cost estimation tool. We utilized our original poster draft to create the current finalized poster that you can see on the right. In addition to this, we organized a focus group consisting of patient advisors from the hospital to discuss their thoughts regarding healthcare cost estimation tools. Some of the key insights that we received were that patients expressed surprise at some unexpected bills that they would receive in the mail after procedures, and our overall conversation highlighted the strong interest patients have for receiving pre-procedure cost estimates. We have provided some quotes from patient advisors for your review on the right. And to assess overall patient and provider perception, we secured IRB approval to start survey-based studies in select departments within the hospital. Our survey is aimed to collect patient and provider demographics along with their overall perceptions of utilizing a cost calculator. We have made a lot of progress within the past month on this front, and we're excited to show you the preliminary data that we analyzed. So here's the preliminary data. We received 35 complete patient responses and 5 complete provider responses from our survey. As you can see in the bottom right, the awareness of the cost estimator tool is very low, with only around 20% of patients and providers knowing about the cost tools. When stratifying the data based on patient demographics in the bottom left, we see that there's no overall significance for the demographic categories when looking at awareness of the cost estimation tool, but we can see that a higher percentage of those aware of the cost estimation tools are within the African American population at a high school GED education level and at an income less than $30,000 per year. As for the survey data, our Likert scale shows people strongly agree that the tool would be 1, useful, 2, that the trust in their doctors would improve, and 3, that they would be more likely to recommend their doctor and Wellstar MCG if given a cost estimate beforehand. However, it's also important to note that patients did not change their decision on procedures due to pricing. They have also noted that doctors rarely discuss the cost of various treatment options during their visit. Further analysis in the bottom shows that patients would start a discussion with their doctors, budget better for their future medical costs, and also compare the price of different procedures if they had access to a cost estimator. And with that, I'll give it over to Varun Nukula to discuss the roadblocks and contingencies.
So there's a number of roadblocks and contingencies that we faced while completing this project. One thing we had to consider is technological implementation, as Wellstar is currently undergoing a major transition to Epic. As this process takes time, we plan to focus on increasing awareness of the tool and understanding patients' views on price transparency. Another challenge is marketing this tool widely to patients and providers. Thus, we plan to utilize weekly newsletters and posters, both in an electronic and physical format. Another challenge is ensuring that we get a good response rate when conducting these surveys. Thus, we plan to continue implementing these surveys over the long term to ensure that we get a good response rate and a high number of surveys from both patients and providers. Finally, we want to get accurate numbers about the usage of this tool. So in addition to surveys, we hope to collaborate with WellStar, IT, and administration to get direct data, quantitative data about usage of the tool. There's a number of stakeholders who are involved in the implementation of this project that we want to consider, including patients, providers, healthcare systems, and the government. Patients are our most important stakeholder, and they often face unpredictability and financial stress when dealing with medical expenses. Thus, we gathered feedback from patients through focus groups and surveys to understand their perspectives on price transparency and how this tool might help them. We also wanted to gather the perspective of providers and understand how much they know about the tool and how it might help them with shared decision-making when dealing with patients. We also wanted to keep the healthcare system in mind, so we made sure to meet with WellStar administration, including marketing, IT, and management, so that our implementation was in line with the goals of the healthcare system as a whole. Our final stakeholder is the government. While we didn't directly work with the government, we believe that our project is really in line with the spirit of the No Surprises Act, as it helps increase price transparency and empower patients in decision-making about their health and finances. Next, Harsha is going to talk about a few of our future steps.
Now we're going to wrap it up by summarizing what we have done so far and what our future steps look like. So as we were medical students, we had to include an acronym for implementing our future steps: synergize, translate, engage, and predict. So let's start with synergize. Looking into the future, we plan to integrate the cost estimator into the MyChart patient portal or the WellStar app to improve the accessibility of the calculator. And we predict that providing the cost info right next to the patient's medical info would increase the calculator usage and improve patient outcomes. So here's what we did. We made a mock-up of how we ideally visualize the calculator integrated into the patient portal. Once the patient opens the MyChart app, they have a drop-down menu of their upcoming visits and procedure. Let's say they wanted more info on the total knee replacement. All they'd have to do is click on the procedure, and they'll be given a brief explanation of what the service is and how much they are estimated to pay out of pocket. And by scrolling down even further, they can see the breakdown of the costs, as well as a link that takes them to the calculator if they want to see how much other treatment or procedures would cost. So coming back to our acronym, we next have translate. We want to provide the patient info next to the price so that it empowers patients to be shared decision makers in their own healthcare. And as we know, various studies have shown that shared decision making and improving health literacy has improved patient outcomes on the whole. Next, we have engage. This is what we have made the most progress in so far. We want to further skyrocket patient usage of these tools through continued marketing and patient and provider education. Lastly, we have predict. Ideally, we'd like to work with WellStar MCG to use historical data to implement the accuracy of cost estimates. And we understand that there's a lot of challenges in acquiring and analyzing this data, but we plan to work with our hospital administration to facilitate this process because we know that it's been done before with other healthcare companies such as Sutter Health. So wrapping it up, we've made significant progress in implementing our project into our hospital by collaborating with WellStar administration and patient advisors, analyzing the data of our IRB approved study, presenting the study to various stakeholders and high-level physicians, and lastly, started our implementation of WellStar approved tools such as flyers, info cards, and mass email to promote cost calculator awareness. And we're looking forward to the future to implement our STEP program and improve patient care as a whole. We wanted to thank the following individuals: for helping to make this project a reality, especially Dr. Philip Kuhl, who helped us take this to the next level. These are works cited. Thank you very much.